Well, good afternoon, and this is the 24th of July, and we are in Scunthorpe at the ARC Centre, and we've just finished our bi-monthly board meeting. So we've been meeting since 10 o'clock this morning, and it's now nearly 4:30. So all I can do on this somewhat short video is giving you some highlights of what our discussions have been about today, and to remind you that if you want to read the full papers, if you want to see the whole board meeting, that is available on our website. So if you want to sort of know more about what I'm saying right now, please do make that effort to go and look at the papers. There are some things in here that I think you might need to do that if you're very interested. But to kick off, there's been a big theme today around caring, or the role of the carer, perhaps, because is a better way to put it. Not only because our staff story this morning came from a member of our staff who has really significant carer responsibilities for family, but equally that we did take a report called the Carers Delivery Plan, which came in Steve Forsyth's name. But this is about not only as an employer, how are we a really good and compassionate employer and take into account the massive carer responsibilities that many of our staff have. In fact, carer responsibilities that huge numbers of the public have now, that I think we are starting to recognise that impact that has on society. I hope other people recognise the impact that has on society. As somebody said, the greatest unpaid health service around, that people take care of loved ones as part of loving them. So we looked at not only ourselves as an employer, but how we involve carers and the impact on carers, young carers and adults, when they or their loved one is admitted to a ward perhaps, and how we involve them in the care plan for themselves. How do we involve the carers in the care plan for their loved one? How do we involve people who've got to come into our services when they've got carer responsibilities at home? So you put all that with the responsibilities that staff have. It's a huge subject, and we haven't finished it this afternoon, but it has been a big theme. We've got a very active carer group. It's quite new, headed up by Cheryl Gowland within the organisation, and there's work to do there to make sure that that group reflects all our workforce. And at the moment, perhaps it's a lot of people in it, but there are parts of the workforce that are not coming forward into that support group. Big theme today, and I'm very glad it was. We had lots to talk about and lots of reflection. There was another discussion which will go forward about the incidence of racism in the organisation. We have a 7-point plan. We will never, ever accept discrimination of any sort within this organisation, whether it's for patients, people who use our services, or indeed for staff. But we've got lots of work to do to eradicate it. Can we ever do that? But at least to bring it to a level where we are dealing with it and where people who exhibit poor behaviour are held to account. Our workforce reflects society. There is many problems in society right now. We are not immune from that. But it is something that we are determined to deal with properly and effectively, as a safe place to work for anyone who comes to work for Ardash, regardless of whatever their protected characteristics are, whoever they are, whatever their ethnicity or any other protected characteristic is. This should be a safe place for us all, and for patients and service users too. So we are committed to that as a board, and we'll continue to do the work that we need to do. This is our learning board. This is the annual board where we really look at learning and education. We took 2 big reports. Education is different to learning, isn't it? Education is around progressing your career and gaining another skill or gaining a qualification. Learning is about being a learning organisation. So we took both reports today, and much discussion about our use of the apprenticeship levy under education. We are confident that we will be using the whole of our levy in about 12 months' time. The education plan was approved 12 months ago, so this was an update plan. But We are determined that we will use our apprenticeship levy. We are really pushing that we can help to use that in community and third sector too. But there was a lot of questions within our update on the education plan around how we effectively use that apprenticeship levy to its full effect. And then in the learning plan, really to look at ourselves as a learning organisation, the use of our learning half days, how we make sure that everyone has equal access to those, how we learn from incidents, how that affects the way we go forward. Really important debates today and very positive ones. But again, you know, we are in progress. This work will go on, I suspect, forever. In that, do you ever really stop learning? Do you ever stop looking for better ways to bring education into your organisation? Really important debate on how do I put this? The quality indicators around older people's services. Thanks to Dermot for bringing a report that was on a very complex subject that was really easy to understand. So what are those indicators in older people's services that will tell us whether we are delivering really good services and how we compare to other organisations in our peer group? It's important that we get that insight and data, isn't it, to know what we're doing. And so it was a good debate around the board table around, are we actually seeing what we need to see? How are we comparing? Are we delivering great services? We've made a lot of changes to services for older people and the way we deliver those. So we need to be tracking whether or not they are safe and effective. If you're going to make change, you do need to know that, you know, you're doing well with that change, and it is producing the right quality of services. So that's very much what this was about. And more to come as those indicators are developed. But a good place to start off, and the right indicators that will tell us how that work is going. I suppose the other one I really want to think about is a report that perhaps not is going to be that exciting, or it is to us, but that's a report on productivity. Now, Izaz brought a report to us today on how we measure productivity in what we do. Now, it's a real buzzword in the NHS, and it's very difficult to get your head round. What does that mean for RDASH? And Izaz brought a report that actually gave us a formula and a way of measuring improvements in productivity. Now, this is not only about how we use the money, but of course that's important because, you know, you're all taxpayers and we've got a responsibility to use your money properly and effectively and as efficiently as we can. But it's about how do we measure those improvements in productivity? What's that about for a trust like ours? It's something about time, isn't it? That people are very specialist people who are patient-facing, that the effective use of their time, making sure that they get as much time as they can in face-to-face with people who use those services. How do we measure that? How can we prove to people that our productivity is improving? And lots of talking nationally about the NHS is getting all this money and its productivity is no better. You're giving it all this money and, you know, the productivity is falling. Well, we can prove from Izaz's report today that we are improving, that our productivity is absolutely improving, and how we measure that, what it means, and how we take it forward. And so for a very complex subject, a report that was very easy to understand, and indeed that you can think, oh, I know what that means now. That may sound a little bit silly, but it really is important that we understand exactly what we're talking about when we say, how are we improving productivity? We're not a factory that makes widgets, are we? We can say, well, we got 2 million out today, we'll get 3 million out tomorrow. That's not how we work. But so huge thanks to Izaz for bringing something that was really easy to understand and gave us the information we needed to be sure, and we can tell people, yes, we are improving productivity at Ardash. So the other one that's really important today, this is Promise 14, and this is Richard Chillery, who is our Chief Operating Officer's report on waiting lists. Promise 14 says that we will deliver a 4-week wait for all referrals from April 26. Now that's a huge promise to you, and we mean it. So how are we doing? You might expect that it's a mixed picture. Yes, of course it is. We have 74 waiting lists in this organisation, but we are doing really well. There is and again, you know, you can read the press, you can listen to the news. There is a huge national focus on NHS waiting lists. This is from referral to being into our services. It's not about your treatment being complete, it's about being referred to diagnosis. At least I think I've got that right. But it is referral to us taking you in for a diagnosis and then treatment. So 4 weeks between those two. Lots of them are already at 4 weeks. We have a list of services, waiting lists that are going to be okay by April 26. And then there is a very small number of waiting lists where they need more work. And it is a very small number. And from the end of this month, we will be publishing on our website what our waiting list times are. Now that's important for people who just want to look and see how well we're doing, but it is particularly important for primary care, who when they refer somebody into our services can give their patients some idea of how long they'll be waiting until they see us. That really helps primary care not have to keep assuring people that they've referred it, for instance. If you can give somebody an indication, well, I'm referring you today, and looking at the Ardash website, it's going to be 4 weeks, 2 days, which is the average waiting list right now to come into services, then people are content with that if they know it's going to be 4 weeks or 3 weeks. If you don't know, and 4 weeks and you're thinking, well, I've heard nothing, then you go back to your GP, don't you? So it's important for quality of services. It's morally right that we commit to that, but it is a huge help to primary care, so they can be confident of when they refer in how long their patient is going to have to wait. Those, I think, are the highlights of today. We approved our people and teams plan. We approved our digital plan, which are enablers to our strategy. But I hope you've got some flavour of what we've been discussing today. If you want to know more about the waiting list issue, then the report is in public. So if you want to go read it and find out exactly where we are with what, then please do. And I hope you think that, well, that board has certainly done some work today, because we have. And I will look forward to speaking to you again in September. So thanks very much for listening, and see you soon.